I became a physician because I grew up in a family with several medical professionals. My father was a physician and my mother was a pediatric nurse as a child. My older brother, who I looked up to, went through medical school several years before me, so the choice to pursue a career in medicine was a fairly easy one, as the path had already been paved for me. I chose pediatrics mainly because I felt that my personality was well suited for the care of kids. I liked the variety and types of problems that came into pediatric ophthalmology clinic when I was training. And I particularly liked the types of surgery that was required of a pediatric ophthalmologist. Most patients I see that are kids, you also have the parents with them. I'm a parent myself, so I can relate to the anxiety that some kids have going to an unfamiliar clinic setting. I can also relate as a parent to wanting to know exactly what is going on with my child and what is going to be done to help remedy the problem. And one thing I like to make sure of is that everyone in the room has an understanding of what's going on and what we're going to do about it. I was attracted to associated eye care in part because of its size. I liked the opportunity to work with multiple colleagues with different subspecialty interests. Working with a group this size allows us as a group to have state-of-the-art equipment and facilities and offer the very best in ophthalmic care for patients of all ages. One of the other things that attracted me to associated eye care was the long, rich history of pediatric eye care in this practice and the value that the partners place on pediatric eye care. It was distinctly different than several of the other practices that I considered joining. When you have multiple pediatric providers and a well-trained staff of pediatric technicians, it can really impact the experience that the patient and the parent of the patient has when coming to the eye care office. Some things I enjoy most about practicing pediatric ophthalmology is the excellent outcomes we can get from the most routine to the most complicated problems that come through our clinic. Even in the routine patients where you're providing the first pair of glasses for a child, it's remarkable to see them before and after with the change in their vision and what it does for them in their daily interactions and their development.